is that time of year. Fall is here, bringing with it cooler weather, but it's also time for the sniffles and the respiratory things and all that, which means you need a flu shot. So today we're talking with Dr. Cynthia Snyder, Cone Health Infection Prevention Medical Director, all about flu shots and how to help protect you and your family from the upcoming flu season. Okay, so let's just start with the basics. Who needs the flu shot?
I would say that everybody who's 6 months and older should get the flu shot.
Okay, everybody 6 months and older should get the flu shot. Okay, so then let's kind of talk about why it is so important that we get vaccinated for flu. Some people think, or COVID, some people think it is just like the flu.
You know, I want to say that there's a lot of misconception of the flu being just another cold virus. And actually, it carries a lot of problems with a lot of hospitalizations. There are still a lot of deaths, and we think of that as being preventable because the vaccine works to prevent hospitalization and severe disease. And not only do we have a formulation for folks that are older than 6 months, but there's also a high dose formulation for the folks who are older than 65, or especially if somebody's had an organ transplant, they would also get the high dose vaccine, and that protects you for the duration of the flu season.
All right, so the flu, not just a cold, it is something that can land you in the hospital. So let's kind of talk about when we should be getting it. When do we recommend getting it, like now, or should we wait until like flu season really gets ramped up?
You know, a lot of people, they tell me when I see in the clinic, like, I'm going to wait. I just want to wait until I know that there's a couple of flu cases in the community when the height of it starts. And we don't have a crystal ball exactly. We know our best recommendation is to get it before the end of October. It takes about 2 weeks for your immune system to build up enough antibodies for that level of protection. So I'm a big fan of saying, definitely just get it by the end of October, especially if people are flying around for Thanksgiving, because we know that, being in planes or traveling, that tends to be the most common times when people are contracting other respiratory illnesses.
Yeah, we seem to share that every time we have a holiday get together, that is for sure. All right, so let's address maybe some thoughts that people have about the flu shot and explain if they're true or false. For instance, you can get the flu from the flu shot.
So people often feel like they get some side effects from the vaccine and they think that's the flu. So it is false. You do not get the flu from the flu vaccine. You can get some muscle aches, soreness at the injection site, some headaches that last maybe a day or two after getting the vaccine, but that is just the side effects of your immune system, like gearing up.
Okay, gotcha. All right, so another true or false. I'm healthy. I don't need the flu shot.
I'm sorry, can you say that again?
The other fact or fiction. People may say, I'm healthy. I don't need the flu shot.
That's the thing about flu. It doesn't discriminate who can get it or who doesn't get it. And in fact, I think people who feel pretty healthy, they feel like their immune system is pretty strong, but it still will take you out of work, right? It will still make you feel poorly where you can't do your day-to-day activities taking care of your family. So even if you're healthy, you can be at risk of getting influenza.
Okay, and then our last fact or fiction, true or false, they got a flu shot last year, so they don't need it this year.
Yeah, that's the thing that's so tricky about viruses, especially respiratory viruses. The flu virus mutates every year. So even though you got your vaccine last year, you do need to get another one this flu season as well to have the best protection against the circulating flu strain.
So lots of people are worried about the potential side effects of the flu shot. Can we talk about some of the steps that we can take to manage some of those side effects?
So usually people can start having the side effects of the injection, like having a sore upper arm. And you can take Tylenol or ibuprofen in the evening, and that usually should suffice. Or I'm a fan of actually getting it in your dominant arm because the more you're moving your arm around, I think that helps dissipate some of the discomfort that's associated with the vaccine.
All right, and we've been hearing about the high dose flu vaccine. Who is that recommended for, and are the side effects similar?
So I would say the high dose vaccine is formulated for folks who are 65 and older. And the reason being it does have a higher load, I guess I would say, of the viral antigens in order to get the proper immune response. We know as we get older, our immune response to vaccines aren't as robust as they used to be when we are younger. So this high dose vaccine works better than the standard dose. You can have the symptoms of the vaccine side effects last probably a few days longer. So I would say that it's not unusual for the people to notice that discomfort for more than 2 days.
And that discomfort in their arm is what we're talking about. Okay. Now, there are some people who will not get the flu shot just because they don't like a needle, which is why there is a nasal spray vaccine. So who can get that, and what are the additional side effects of the nasal spray?
So with the nasal spray, this actually has been around in the past, I believe since 2003, but it was pulled off the market because it wasn't formulated to have enough of a vaccine response. It is the only FluMist is the only needleless flu vaccine available, and it's marketed for people who are older than 2 to 49 years old. And that is one option if somebody has like a fear of needles or convenience, unable to get to the pharmacy to get that vaccine. However, it's not as effective as the like injectable flu vaccine. And I would check with pharmacies because I'm not sure if the timing is going to work where it's going to be widely available for this flu season.
Okay, that is good to know. Now, we know that you don't have to go to the doctor to get your flu shot. You can go to a pharmacy. Cone Health has those pharmacy locations. Do you need an appointment for that?
So I think it really depends on your, I think the pharmacy's website would show some appointment times, or you can call ahead. But I think that's what's great. You know, over the last few years, you get all your vaccines through the pharmacy at your convenience, right? You could get your flu vaccine, you could get your COVID vaccine at the same time. You can even also, those who didn't receive the RSV vaccine last year, for folks who are 70 and older, they can also get an appointment and get all those vaccines for the flu to prevent any respiratory viruses this season.
Okay. And once you get the flu once, you know you don't ever want to really get the flu again because it's awful. So in addition to getting the flu shot, what other steps can we take to protect ourselves and our family?
You know, that's the thing. We already know this. We've been through, since the pandemic, a lot of us have become well-versed at hand hygiene, wearing masks, you know, especially if you're about to go travel, you know, wearing a mask on the plane. Or if you know people are symptomatic in your household, hand hygiene, wearing a mask so that you yourself don't also become infected with it.
All right, we have about 1 minute. What kind of over-the-counter medication should we have at home in case we're exposed to the flu or get the flu?
I am a fan of just old school. I would just take Tylenol and ibuprofen, stay hydrated. If you have some nasal congestion or cough, you know, you can think of like Robitussin or guaifenesin kind of combinations. So it's really, you know, just going to your local pharmacy and seeing what symptoms works best.
Okay, and any final quick thoughts about the flu shot itself?
You know, nobody likes being sick and taking time off, you know, and you want to be your best during the winter because there's so many activities to attend. So I'm a big fan of getting all the vaccines that I'm eligible for.
Okay, thank you so much for your time and your expertise. We appreciate it.